Hi, and welcome back to Health Source of Ohio's More Than Medicine podcast. I'm your host, Jen Patrick, Community Relations Director, and today we're going to be discussing America's health centers and why creating community health centers is so important to building healthier, happier, vibrant communities. Today, we are joined by Julie DeRossi King and Teresa Rios Bishop from the Ohio Association of Community Health Centers, discussing how community health centers create healthier, happier communities. I gotta tell you guys, sitting down with these two was like sitting down with two of your best friends. The passion that they have for serving community health centers in the state of Ohio is contagious. We bonded throughout this podcast over a shared mission of just providing public health to Ohioans, about our love for our families and everything Ohio. It truly was just like having a conversation with your best friends. I enjoyed it immensely, and just the knowledge and passion they have for Ohioans and community health centers is incredible. So I encourage you to join us. Get comfy, because it's just one of those episodes where you leave feeling energized. I drove back from Columbus and I couldn't wait to get to work the next day and just do all the incredible things that they talk about. You will not find two better champions for community health centers and for Ohioans. So let's get started. Hello, ladies, and welcome to Health Source of Ohio's More Than Medicine podcast. I am so excited to sit down with you and discuss America's health centers in celebration of the 4th of July. I'm sure that the three of us agree that community health centers are America's best kept secret for healthy, thriving communities, but I'd like to give each of you an opportunity to share in your own words, what exactly is a community health center or an FQHC, and why are they so important to our communities?
Thank you so much for having us. It is really exciting to be here with you and the audience. Thank you so much. I love community health centers, and the first thing I want to say is health centers are the right kind of care at the right time in the most appropriate setting. So focusing on keeping our patients and communities healthy, and then when we are sick, manage those appropriately. And so that's obviously great for their quality of life, the quality of our communities and the health of our community, and of course, cost effective for not only patients in our communities, but then the healthcare system as a whole. So the community health centers are providing integrated whole person care. Oftentimes you're going to find medical, dental, behavioral health, vision services, and oh, guess what? You can also visit the pharmacy on your way out the door. So very integrated and whole person looking at a very holistic picture. And so we here at the association, we are the Ohio Association of Community Health Centers, and we have 57 FQHCs or community health centers across the state. And that represents probably about 430 sites and represents nearly 1 million Ohioans. So it's pretty amazing the breadth and the access that the health center network here in Ohio provides. And then nationally, we're looking at closer to 30 million patients across the country among 11,000 sites. So we are the largest primary care health network here in the state of Ohio and across the country, and it's exciting to be a part of that.
Absolutely. And Julie talked a little bit more about the cost effective and the whole person care. And the thing that I am drawn to about community health centers is more the heart, and community health centers are the heart and soul of each community and is driven by the community. And that is just a remarkable. Nonprofits are great. Every nonprofit serves a community, but health centers really are driven by the community, which makes them so unique. And driven by the community means that you direct your care. So if you need a certain service in your community, podiatry, for instance, then you are on the board and you get to say that you need podiatry. And talking about whole person care really means that they're looking at every need you have. So primary care providers are very great. They have a great lens into the quarterback of your care. But when you're looking at a community health center, like Julie was saying, that warm handoff really makes a difference and makes people healthier and makes communities healthier. So it's the heart and soul for sure.
Absolutely. And the other great thing is we're open to everybody. So we serve the entire life cycle from our newborns to their great-great-grandparents and everybody in between. And we are here for everybody, regardless of your race, the language you speak, where you live, and we're here to serve.
Absolutely. And I love that you said serve the entire lifespan. I can tell you that my niece She's 5 now, but she's been a patient since the very beginning. And my grandma, who will be 90 this year, is also a patient. So we see everybody within our communities. And again, those heartstrings, your guys are speaking my language. So I'm so excited to sit down with you, and we'll be right back.
Have you heard about Health Source of Ohio? We serve 8 counties in Ohio. We're a National Quality Award recipient. We offer family practice, pediatrics, dental, vision, OBGYN, and behavioral health services. We also offer special services such as mobile dental, school-based health, care management, and outreach and enrollment. We're accepting new patients now, and we take most insurance plans. Learn more at healthsourceofohio.org.
Welcome back. We're here with Julie Durossi King and Teresa Rios Bishop from the Ohio Association of Community Health Centers, discussing how community health centers create healthier, happier, vibrant communities. Julie, as the Chief Operating Officer here at OACHC, can you tell us more about your role and how OACHC furthers the mission of community health centers like Health Source of Ohio?
Absolutely. So as the statewide association representing all of Ohio's community health centers, including Health Source of Ohio, really our mission is to support our members and so we can provide collectively access to care to all Ohioans, and do that through the growth and development of our community health centers. So some of the obvious things that the association does to support our health centers, certainly in the area of clinical and quality improvement. Workforce is another big area, but also advocacy. So we are, that's probably something that touches everybody here at the association, and using our voices collectively, but then reaching out not only to our health centers and their awesome teams, their phenomenal boards, but patients too, and other stakeholders out there. We want everybody to feel educated about health centers. And once you know what a community health center is, you're going to be like elbowing people to get to the front of the line and raise your voice. So, and it's not only with our state and federal officials, certainly with our stakeholders. So we like to say here, health centers are not only the provider of choice for our patients and communities, they're the employers of choice for their teams, and also be the voice of our payers. So working with insurance companies and things like that, and constantly improving the care that we're providing. So how we get to play a role in supporting you all in that phenomenal work, and it truly is a privilege.
Absolutely. We love working with you guys, especially on the advocacy side. You guys are such champions for community health centers, and I think you're absolutely right. The more folks learn, the more they just begin to embrace and embody what it means to be that community health center. We like to capitalize unity when we say community, because once you hear about us, you want to be a part of it.
Yeah, I love that.
All right. And Teresa, as the Director of Membership and Development, can you tell us more about your role and what sets OACHC members apart from other healthcare organizations?
That is a great question. And actually, I would feel what you said is that we're the champions of community. And I think that's what we look at holistically for the entire state. And, Health Source is an easy health center to point to, and we do often because you all do so much with your patients, with your community, and it's fun to share that with others because you kind of are the crown jewel. You do it all, and so it's easy to point to that. So as the membership director, I have the honor of being able to try and wrangle everybody and figure out what are your needs, what do the community health centers want, what do you need more training on, what do you want to hear more about, and that's really fun, supporting the great work that you're all doing. And then on the development side, just making sure that, as Julie mentioned with the advocacy, developing health centers in any way that we can, making sure you have resources and tools, whether that's access or knowing about them. But really, it's one shared mission, one shared goal that we have with the health center. So we kind of see ourselves as an extension for that go-go gadget arm, kind of reaching out for everyone in the entire state so that they know about Health Source of Ohio and your sister health centers across the state and the wonderful work you do, because you're right, once someone hears about a community health center, it is unity. I'd love to have people elbowing and screaming, but I love what you said, the champion of care and the champion of community health centers, because I really feel like that's all of our roles here at the association.
I do too. And I just got to share, one of my favorite days of the year is when you guys bring all of our marketing teams together. It's really nice to kind of brainstorm and just hear ideas, bounce ideas off one another.
So while that might not be necessarily one of the things you guys see you doing every single day, it is so important, and it probably would not happen without you guys kind of being that middleman, or I always use you're the gear that keeps us all moving in that right direction. So it's really nice to work with you and to have you coordinate all of the community health centers across the state of Ohio. So thank you.
Yeah, thanks, Jen, for saying that. I think that's one of the great things we do, and I failed to mention that, was the peer networking among health center staff, cross-pollinating ideas. One of the greatest things in coming to OACHC I learned is I've worked in advertising agencies, and it's very close to the vest. You don't share your clients. You know, everything's very secretive, and people are trying to steal things. But at community health centers, and I'll say we're called a primary care association, OACHC. It's kind of like everyone shares, because we all really are that one shared mission, one shared goal. And the goal is to have healthier communities across the nation, and especially here in Ohio. So bringing those peer networks together, you mentioned the marketing outreach folks. We have them for our providers, we have them for the QI folks, we have them for our HR folks. We're trying to find where we can support you all and the great work you're doing. And HealthSource has everything. So hopefully you're all plugged in, because you all are in such great positions for your community and engaged and always willing to share. And we love that about you, because shining example of best practice, where do you go in HealthSource of Ohio?
Well, thank you so much. We really appreciate that.
And I would say one other thing that sets community health centers apart from other providers or OACHC from other associations is, you know, there's so much focus, rightfully so, right now on social determinants of health. And I think one of the coolest things is the health center movement has been around for more than 55 years. And social determinants of health has always been one of our key, part of our key foundation, quite frankly. And so certainly everyone can do better. But it's not just what happens inside the four walls of the medical exam room. And I think we talked about earlier, certainly it's medical, dental, behavioral health, vision, pharmacy services, and so much more. But it's also, how do we lift up our patients and communities? And that's what you all do so very well. And it's been, you know, with you from the beginning. So that's awesome.
Well, thank you. You're hitting on exactly why we titled this podcast the More Than Medicine podcast.
Oh, there you go.
Yeah, so we really want to sit down with stakeholders like yourselves throughout our community to figure out where those gaps are, where those gaps for social determinants, and really address those. So thank you for that. We really appreciate that. And we'll be right back.
HealthSource of Ohio's Outreach and Enrollment Team offers free assistance to all community members with Medicaid, SNAP, and Marketplace applications. With the current Marketplace special enrollment period and the new American Rescue Plan advantages, call us for assistance in reviewing your current plan and to see if you qualify for increased tax credits that lowers your monthly premium. Call the Outreach and Enrollment Team at 513-707-9901 today to schedule your appointment.
Welcome back. In celebration of Independence Day, we're sitting with Julie DeRossi King and Teresa Rice Bishop from the Ohio Association of Community Health Centers, discussing how CHCs build and create healthier, happier communities. I know that one of the things we are all passionate about is increasing access to care for all Ohioans. Can you guys explain how community health centers and organizations like the OACHC ensure access to high quality, affordable care, and why this is so important not only to the patients that we serve, but to the communities, to all of Ohio, and to the entire country?
Great, yeah, that's a big question and a lot in there. So I will talk a little bit, and I'll take the patient role. I do a little more of the grassroots advocacy here at the association. So I like to hope that I can harness the patient voice. It is very loud and so very important in the movement that Julia talked about, because everything we do is centered around the patient. And so having that at the center of everything that the association does, and obviously community health centers and us supporting you all, is the key factor. And being a patient and having that voice in your care is just remarkable, because it allows you to really direct your care. You know, there's lots of things on health literacy, health insurance literacy, and taking in a sheet and saying, you know, I need to talk to my provider about X, Y, Z, and that's great, and everyone should be doing that. And hopefully all the listeners are. I know I forget sometimes and leave the office and say, gosh, I wish I asked about this, but that's a key thing to do. But it's more than that at a community health center, because you really do have the opportunity to impact the care for you and your community. If you see something like Julie mentioned, the social determinants of health. If you see there's a issue or a problem in your community, you can start with your community health center. And if they can't do it, you can bet your bottom dollar they have a partner that they already have lined up that can take care of that issue for you or support you through that issue. And that is really fantastic to have that voice as a patient to start and say something in my community needs fixed and I can fix it. And having that power as a patient is really phenomenal. So I think that's how community health centers can impact, and that OACHC Health Source can come to us. And if we have another sister health center that maybe has figured out that issue or problem or walk the patient through or community through, that's where we can connect the health centers across the state and give the patients an even bigger and broader voice, which is really fun and exciting. And I think it's exciting to be a patient at a community health center.
I love that. You guys definitely do take one voice from a community and turn it into just an entire group effort. And you do that wonderfully. So it becomes very loud and something you can't ignore. And that's something that I just think is so powerful and so just invaluable to community health centers and just communities in general.
Absolutely. Yeah, as Julie mentioned, with serving over 1 million people, that's 1 million strong voices. And so that is something, like you mentioned, that is loud and you cannot ignore 1 million people. So that's fantastic. We serve, as community health centers collectively, we're about 1 in 14 Ohioans. So that's a lot of people, and 1 in 7 Medicaid beneficiaries. So if you're a Medicaid beneficiary, you have even a louder voice in the direction of your care. So that's exciting. And then it does go to a community. And so when the community comes together, and so being connected in the community as a community health center is, they have the pulse in the community. I know Jen sits on many community boards and is very active. And so she's listening. So maybe a patient's afraid to say something, but she hears her community members saying something in another meeting, and then they can take that to the health center again. So being part of the community and of the community, by the community, it's, people like to say things like that, but community health centers really walk that walk, and I think that's impressive.
Absolutely. And I think the impact, so you take that collective impact to the state and national level. You think about where a community health center often is located. And so part of our mission is reaching into our underserved communities. They're our most economically depressed communities here in Ohio and across the country, and raising them up and making them a priority. Oftentimes our underserved communities can be overlooked. And they have different challenges, whether that's broadband access in our rural parts of the state, or just it could be a high needs area. It could be there aren't very many providers that take my insurance, or I don't have insurance and I'm not sure where I can go. And so we want to be that health home for everybody, regardless of their circumstance, regardless of their background. And that has obviously tremendous impact on our patients and our community's quality of life, but then there's also real economic impacts at the state and national levels. And certainly everybody deserves access to quality care. And I think, but there's also, dollars and cents that you can put behind that as well.
Absolutely. I think you're both hitting on all of the key topics that we, try to address here at HealthSource, and all of our community health centers address. Teresa, you mentioned being out and about in the community and involved in different groups. And it doesn't matter if we're attending an event planning meeting or if we're at a job fair or health fair. The one commonality that we see with every organization is health. So again, community health centers are that center, and we're kind of interconnected to everything, whether it's a business or, Julie, you mentioned broadband access. That is one of those, I grew up in rural Brown County. We don't have broadband. And it wasn't until the pandemic that my voice then came. I realized it was a collective voice. It wasn't just me and my community. It was all of Brown County. It wasn't just Brown County. It was rural Ohio. So it's just those things that the more we can talk about them, the more we can bring them to light. And again, that commonality with every single Ohioan is going to be their health. So whatever we can do for them to raise that up and meet their needs and provide quality health care to all, I think the better. And you guys are such a key role in doing that.
I think another cool thing about health centers across all levels, local, state, federal, is the focus on prevention and the accessibility, the affordability, certainly. But when we think about the pandemic that we're coming out of now, and we're seeing hopefully a lot of light at the end of a very long and dark tunnel at times. But health centers have been around for nearly over 55 years, and they have become the community leaders, the trusted resources, the trusted voices. And I know I personally had tons of questions, and I work in health policy and the healthcare community, and I had a gazillion questions. And so there's misinformation out there. You weren't sure where to go online, who do I trust? And so because of the phenomenal work and that health centers have that solid foundation and that trust there with their communities and their patients, they were able to rise up and in some of the darkest times serve as a really bright light for all of us. And so particularly when you think about whether it's a needs issue or an access issue, or you just, the quality and customer service you get at a health center. So regardless, that's where I'm going for my care. That it was already there. It was already built, and we certainly continue to build on that. But that was, if that wasn't there, I just think of how darker the pandemic would have been, particularly for our underserved communities and populations. So my hats off to all of you. I'd love to say hashtag not all heroes wear capes. I say that in a lot of my emails and my communications when I'm talking with you all. And you have continued to be so inspirational. You all are just an amazing team of people with compassionate hearts and always there to give somebody a hand up or lift us all up, and it's been remarkable.
I will completely echo that. I have been blown away with all of our staff. It has been an incredible thing to witness. It's, as health source, I've always thought we provided the best in care. When you're faced with a pandemic, it's something that you had no expectations for, no clue how we would address. And sometimes you worry that it maybe expose some of your weaknesses. I do not see that. I have not seen that. It just brought to life how great of a team we are, how great of just folks and caring individuals that we have on our team. And I think that's not only health source, but all of our community health centers and everybody involved in this movement. We showed up, we wrapped up, and we went to work and didn't ask questions.
Right, absolutely. And I mean, first it was the Ppe shortage, and I think as collectively as a community, and whether state, local, nationally, we all came together and worked on making sure there was enough PPE for our health centers. Maybe not always being able to meet the need, but definitely every day trying. And then it was testing, and we saw community health centers. You think of the doctor's office or the medical home who turned into mass testing sites or mass vaccination sites. And it was just, I love to say pivot from, that's a shout out to friends, all of you out there who's like, friends, but you did. I mean, on a dime, it was just.
We look to you guys a lot for that. You guys, again, another example of you guys bringing folks together and us sharing best practices and being able to really figure out how to not only address our communities, but the communities across the state. So it was a collective effort for sure, and one that I am so grateful for that part of. Hear, hear. Ladies, as we conclude this episode, I just want to thank you for your time and your passion for providing quality care to Ohioans like myself, and give you an opportunity to share some final thoughts. So what are the top 3 things you wish our listeners knew about community health centers and or OACHC?
Well, thank you, and thank you for having us. This has been wonderful. We love this. This is one of our favorite things, is sharing the community health center mission movement and talking about the work that you all do, because it is so inspiring. We're going to leave here today and just have a pep in our step, because it's incredible. And to be able to talk to more people about community health centers, the more the better, the more the merrier. But if I had 3 takeaways, I would say probably reiterate a lot of things that we talked about, that community health centers are the largest primary care network in Ohio and the country. And if you think about that, that's pretty phenomenal, that we are the largest network of providers. And so that means providers and then all the staff. So when we talk about our peer network, so we're the largest marketing networks. And I'm going to give a shout out for the outreach and enrollment staff who have my heart. So it's a great team of people and the largest network of people that are providing community-based care. And so that, if that doesn't get your blood pumping and excited, I'm not sure what will. that the services under one roof is just phenomenal. We often go out and do talks, and so I start a talk out with a group that may not be as familiar, and I say, how many of you go to a primary care doctor? And some people maybe need to get a little bit better. And then I say, how many of you also have your dentist in that office? And the hands start to go down, and as Julie mentioned, how many have vision in the office, all under one roof? And obviously the hands start going down unless they are a lucky patient of a community health center. And so being able to say that we provide all those services in one roof is just a great place if you're thinking about a busy mom with kids and you have one day that you can pick off of work and get everybody all the services they need. Transportation's a barrier, and so you can't go to separate appointments. It's a great service, and as we learned from the pandemic, convenience and driving up and doing that, healthcare is no exception to that, and the innovation that health centers have of meeting the needs of the community, and we've been doing that forever, and they're going to continue doing that. So having that convenience under one roof, and then being the backbone of that primary care network, the 55-year history and the legacy of the movement is just something that, your doctor's office may have been the community doctor for years and years and years, but community health centers have been doing the social determinants of health, as Julie mentioned. And some of these innovative things of care, one of the founders of the community health center movement, Dr. Jack Geiger, he recognized his community didn't have food or proper nutrition. So he was writing out pharmacy slips for folks to go get food. And that's, again, if that doesn't inspire you and give you goosebumps on primary care as being a whole person care, then I'm not sure what will. So those are my three things that I hope people understand, that it's a heart and it's a numbers game. And so community health centers have both of those. So there's no reason not to fall in love.
Thanks, Teresa. I couldn't agree with you more. I would also say, when we think about lifting up our underserved communities, oftentimes I think there's a stereotype out there about the kind of care that's offered when you're uninsured, or maybe you have Medicaid coverage, or whatever the case may be. And one thing I am so proud of, and I don't think we get the opportunity to shout from the rooftops enough, or not loud enough, so you can join us in that, it's the quality of care that you receive at a community health center is as good as traditional or private practice, if not exceeding, and we have national studies and journal entries to document that. So community health centers, technically designated as a federally qualified health center, if you've heard that term, or an FQHC, holds very strict financial, administrative, clinical, and quality outcomes, have been, and so I think we're getting into new areas and being measured for value and looking at our outcomes. This is not a new day for health centers. You all have been doing that forever, and sharing data. I think we talked about that, and sharing best practices. And so that's just sort of in our blood, right? We've been doing that for a long time. But I'm just so proud of the quality of care that we're able to deliver, again, regardless of one's insurance status, regardless of your ability to pay. It's phenomenal care, no matter who you are, what your background is, what you look like, the language you speak, and so that's awesome. And I think, Jen, you so well said at the top of the segment, America's best kept secret, community health centers, and we don't want that to be the case anymore. So I would ask all of you out there to join us in raising our collective voices on behalf of community health centers and the patients and communities they so well serve. And I think Teresa can tell you how to do that.
Yeah. Yes, and what we're asking is everyone to join the movement of community health centers and raising their voice. And what we're doing now, we're so excited to launch Putting the Power of Advocacy in the Palm of Your Hand. It seems everyone has a smartphone these days. And so what you could do is grab that smartphone and text 52886 and put in the line there, OACHC, all caps, and you'll be connected with thousands of other advocates to raise your voice on behalf of health centers like Health Source of Ohio and the tens of thousands across the country, to let everyone know you support health centers, their mission, and the policies that impact the health centers, which often could be good, and we want to support and say thank you to our legislators, or sometimes if they're threatening, we want to make sure and let them know that our health is important, that our communities are important. So make sure you grab that cell phone, text 52886 OACHC, and join our digital movement.
Well, I will absolutely join that movement. I love all that you guys do. You guys are always sharing valuable information. I know I follow you on Twitter and other social media platforms just to see what's going on. So you guys always have a great pulse on, like you said, the threats,
but also thanking our legislators and letting them know that we do value their partnership and how much they support us, because we do get wonderful support from all of our legislators. So it's really great to be a part of.
Yeah, very strong bipartisan support. No matter, you all, what you do each and every day, and that just speaks to everybody. And I think I've been with the association about 15 years, and one of the first events I ever attended, it was actually up in Cleveland, and at the time the county commissioners spoke first, and he said, I just love health centers, and I don't know, you either don't know about community health centers or you love them. There's really not. And if the mission side doesn't grab you, certainly the cost effective side grabs you. So there's something that for everybody, literally, and could be more true.
Yeah. I could seriously go on and on, I think, with you guys all day. I think earlier you mentioned, like, if you don't leave here with goosebumps, if you don't leave this conversation, leave this podcast feeling empowered and excited about community health centers, then you're missing out. And so I hope this isn't the last conversation where I get to sit down with you guys and really discuss more about OACHC and community health centers. Because like we said before we got started today, I think this is just kind of tipping our toe and what it means to be a part of this movement. And again, you guys are a wealth of knowledge. We come to you guys a lot for either support or even just that fellowship of what it means to be a part of this movement and this mission. So ladies, I hope we can come back again and do this soon. I love it. Yes. I love it. So I want to thank you guys for sitting down with me and having time with me today. And we look forward to having you back soon.
Absolutely. Thanks for having us.
Thank you.
Oh, and next month we're really excited because it's National Health Center Week. And so usually around the second week of August each year, we celebrate community health centers all across the country, certainly here in Ohio. And in 2021, National Health Center Week is August 8th through the 14th. And the theme this year is the chemistry for strong communities. And certainly that is what community health centers are. And so we love National Health Center Week because while we try to shine the spotlight on community health centers and our patients and communities are well served all the time, really this one week a year, it's super elevated. You'll have, policymakers weigh in and do proclamations, and it's a great time to raise awareness and to visit your local community health center. So Teresa can give you more information for sure.
Yeah, thanks, Julie. National Health Center Week is probably one of the most fun weeks here at the association. Our staff has the opportunity to really get out and see the mission in action. And that is what is most exciting for us, because we sit back here at the association and support, and we especially now do Zoom calls and conference calls, but being out and seeing in person the lives that are touched when you have community events, seeing the stakeholders that come and the partners that you come, it's just phenomenal. We don't even realize all the tentacles that are out in the community until we are out on the scene at a community health center. And to see the great staff and the team, we don't get to see people like Jen and her team often enough, and just have that human connection. And to reinforce for us, this is why we do what we do. Health centers get to see the patients and the reaction of the patients, and see someone smile after having a dental cleaning, after never having their teeth cleaned. And so we don't get to have that human connection touch. So it's really great for OACHC. And we want to also, like Julie mentioned, have those policymakers. National Health Center Week was born out of making sure that when those federal folks our congressional staff are on recess, but they're in the district, they're coming to the health center and seeing firsthand the great work that you're doing. Because if we're removed here at the association, in Washington, they're even more so removed, and they need to be reminded that there is this wonderful resource in the community health center, that is doing pretty much everything for the community, from the health to the whole person care, like we talked about. Social determinants of health is the hot button topic. Anything that you are talking about on Washington, on those halls, and statewide too, you can trace back to Community Health Center and how they are impacting the community and the lives of the community. So Health Center Week is just a great time to remind everybody, like Julie mentioned, we say it 365, 24/7, but that's that week where there's a day, a week, a month for everything. It seems my son, June 10th, is Yo-Yo Day. Who knew, right? But National Health Center Week, the 8th to the 14th this year, and we're really excited for 2021 because the world is opening up a little bit more. And so we're excited to see more human spaces, not just on screens, see more people get out. There's more back to school festivals. There's going to be great kickoffs, fundraisers, health centers being able to show and strut their stuff in person again, which is exciting for us. And I think exciting for the community and exciting for partners and legislators to see.
And last, but certainly not least, thank you, listeners. I hope that you enjoyed our time together today and that you have a safe and healthy 4th of July and that you'll join us for National Health Center Week happening in August. We hope that you'll tune in again for our next episode and be sure to follow Health Source of Ohio on all of our social media platforms. And of course, subscribe to the More Than Medicine podcast on your favorite podcast app. And until next time, please remember, together we can create healthier, happier communities, one episode at a time.